South Africa's COVID-19 inoculation drive has been heavily criticized for being too slow, with repeated setbacks that have worsened the situation. While other countries have already started vaccinating their ordinary citizens, South Africa has only managed to vaccinate healthcare workers and persons over the age of 60. Government only recently started vaccinating teachers, but many are still asking questions about the vaccine's level of efficacy. Do they offer full immunity or not? Joining us to tell us more about this, we speak to clinical virologist Dr. Kgadi Maphoto. Dr. Maphoto, very good morning to you. Thank you so much for your time. Big question, do they offer some level of protection, especially now with a lot of fear around the Delta variant? How much protection do the vaccines that are on offer here in South Africa offer?
Good morning, and good morning to the viewers. And that's a good question, and a question that has been always, going around. The vaccines that we have, or at least the ones that have been registered and have been looked at by WHO, offer some immunity towards COVID-19 disease. So if we may take it back, a vaccine may be composed in a way that it either stops infection or prevent infection or prevent disease. So in terms of vaccines that prevent disease, is that it will prevent severe infection or mild mild disease or severe disease, but it will not entirely prevent the infection. Is that when you get the infection, it does not then go into a severe infection or a severe disease. Then you end up with hospitalization and ICU. So most of this COVID vaccine, when they were looked at during the clinical trials, they were mainly looking at the primary outcomes of severe disease and also of hospitalization and ICU admissions.
Let's now expand a little bit on the vaccination process, because we're learning of reports in the US where it's reported that nearly all COVID-19 related deaths are now among the unvaccinated or those that are not fully vaccinated. Is there a danger in not being fully vaccinated?
So, yeah, in terms of fully vaccinated, it depends on the vaccine schedule that the country has decided to go on. For instance, if you have a 2-dose schedule, the first dose would usually most of the time be a primer. It will just prime your immune system and not necessarily fully protect you or fully confer protection. And the second one would then be the one that actually completes immunity. So if you have one dose, you might not be fully protected, and there is a high chance that you may get a disease. And if that vaccine was to protect you against severe disease, you may end up having severe disease.
There's been a lot of concern, Doctor, around some people who are still skeptical from getting the vaccination, especially with what we heard with the J&J batches and that talk about contamination, and also some of the side effects that we're now learning of. What would you say to perhaps give more depth and detail around the side effects? I mean, there have been reports of people who have died after being vaccinated. How much substance is there to the side effects and the impact of the actual vaccination?
So with regards to side effects, we know that there are major and minor side effects, and major and serious adverse events that are usually thoroughly investigated to determine the causality, so that we then bring back the confidence in vaccine again. So that I have confidence that South Africa has got that going on, and they will let us know that if there is a serious adverse event. And I think the process should be so transparent that even we come back to the very same users of the vaccine to tell them actually what we find, so that we have that confidence back to the community. So if there are serious adverse events, there are committees, there are aspects that have been allocated to investigate thoroughly as to whether we have the causality. And should there be causality and they are confident that it is associated with vaccine, they will, take measures accordingly. And, that brings also confidence in terms of the FDA withdrawing the J&G with regards to contamination, that they actually do take safety very seriously. They actually do, inspect those batches prior to distribution, or there's a continuous monitoring of these vaccines.
We saw scores of EFF members taking to the streets in Pretoria on Friday, speaking about a Russian and a Chinese vaccine and demanding that government present South Africans with these options. Is it a matter of choice when it comes to which vaccine would be best for who and at what time? If I had a choice, which vaccine should I choose if a question like that has to be put forward?
Unfortunately, with COVID vaccine, due to the limitation of or availability of the vaccine, there isn't much choice in terms of the vaccine and the availability. And we know, and we've seen that in the country with our vaccine rollout being slow in terms of those. But it's actually, the process of actually giving SAPRA to go into details to determine the safety and the efficacy around South African, population. We know that we're a very unique population in terms of HIV burden, in terms of TB. So we give SAPRA to really determine whether this vaccine is fit for a purpose for South Africa. Otherwise, we're going to have vaccines that are there but are not actually doing good in terms of efficacy. So I think, SAPRA needs to be given that time to really determine whether this is good for South African context.
And if one has recovered from COVID-19 and looking to still get vaccinated, what sort of time frames should one be considering here and looking at before getting vaccinated?
Well, in literature and what has been explained is that 4 weeks, 4 weeks, interval should be adequate enough, but also that depends on the severity of the disease that you would have had, especially patients that have been hospitalized for a longer period. So that will depend from individuals per individual, and that will also be determined as and when the healthcare worker sees it fit for them to get vaccination. But the minimum that has been explained is 4 weeks.
And in our efforts to try and demystify some of the myths surrounding the COVID-19 vaccine, what do you think are some of the most dangerous myths that you've heard around the vaccine that you feel should really be corrected as a medical expert?
Well, I think, there's been videos going around of magnetic fields, and magnets within the vaccine. And I think that, it's something that needs to be demystified in terms of what goes into the vaccine, what are the contents of the vaccine. And, people, when you go for vaccine, you are allowed to ask for a patient leaflet or the packaging set just to see what goes into the vaccine. And as far as we know and what is in the vaccine, there is not any other electronic magnetic particles or anything that goes into the vaccine. So that has been the myth that has been going on, and I've been asked, of course, by family members as well to say, is there a magnet in, is there a chip in, and so forth. So there isn't as far as the content of the vaccine is concerned. And
very lastly, before we let you go, say one person has been vaccinated and comes into contact with the people who have COVID-19, should the vaccinated person be taking the non-pharmaceutical measures as prescribed, or are they safe to just walk around and feel that they're safe because they're protected by the vaccine?
Look, in the previous year, we've seen that viruses mutate. Viruses have got, they're very clever. So as far as we know right now, we know that we've got so many variants that are going on around, and some of them at the moment we don't know if the vaccine are actually working for them. So from my side as a clinical virologist, I'll say yes, you've got a vaccine. Yes, your next door neighbor does not have a vaccine, or even your parent does not have a vaccine. So continue protecting yourself for other variants that may crop up that may not necessarily be fully, responding to the vaccine that you had. Because remember, there is no vaccine that is 100% protective. So you need to, continue with that. With social distancing on the non-pharmaceutical things to protect yourself, because we also know that there are lots of variants and you may have come up with a different variant and we don't know that.
Very well. We're going to have to leave it there for now. Thank you so much for your time, Dr. Kgadi Maphoto, clinical virologist there, trying to demystify some of the myths around the COVID-19 vaccine. The list is long, but that's where we're going to have to leave it for now.